Now we reached the last part for assessment of our tumor in male patient, 61 years old, present in the right lower lobe, central location. We are done with the tumor cell type. We reached that patient tumor follows the criteria of small cell lung cancer. Now we are done also with the tumor staging. It was T4. We are done with the nodal staging N3. Now we reach to the metastasis staging. Metastasis is M0 if no metastasis. It is M1 if there is metastasis. M1A, B, C, these are further divisions of M1. What is considered M1A is present of pulmonary nodules in the contralateral side of the primary tumor. In our case, there is no nodules to be seen ipsilateral or contralateral, so we will pass by this. We have in our case non-regional lymph nodes. We will talk about them on the scan. Multiple extrathoracic metastases. We cannot judge it in our case because our assessment is only concerned with the CT chest. This is not a full assessment for the M staging. We'll talk about the M staging according to the available scan we have here, the CT chest. Presence of primary tumor with separate pulmonary nodules, if they are ipsilateral, this will play a role in the tumor staging, not the metastasis staging. If present in the same lobe, like in our case, if we suppose we have nodule, separate nodule in the same lobe, which was right lower lobe, so it will change the staging into 3. If the separate nodule present in the different lobe, in our case is right-sided lower lobar. So if the nodule is present in middle lobe or upper lobe, this will render the tumor staging into T4. So separate pulmonary nodules, if they are in the same lung, will play a role in the tumor staging, but only if they are present in the contralateral lung, like in our case, if the nodule or nodules present in the left lung, it will cause that metastasis staging will place in M1A. All these possibilities are not available in our case, but I mention it because we talked about M1A in this classification to understand what's going on here. Regarding M1B, let us talk about our case. Here in the mediastinal window, we talked about the regional lymph nodes and the nodal staging before. What we can find here, presence of right axillary lymph node enlargement, which is considered M1B. What are the non-regional lymph nodes? You can find the full details of regional and non-regional lymph nodes in the nodal map and the nodal staging. Here, we can say that these are considered extrathoracic metastases, and they are internal memory or internal thoracic lymph nodes, axillary lymph nodes, and diaphragmatic lymph nodes. We have already also diaphragmatic lymph nodes in our case. Let's see them. So either single or multiple regional, non-regional lymph nodes is considered M1B. Here we have the what's called circumcardiac or diaphragmatic lymph nodes, as you see here. So presence of right-sided axillary lymphadenopathy and diaphragmatic lymphadenopathy. This is M1B. So now we reached to the final staging of our case, which is 4A. We have T4, N3, M1B. M1B with any T or any N, this is stage 4A. It will be 4B if we have multiple extrathoracic metastases. So as you can see here, presence of metastases play major role for staging. M1A or B, both can affect the staging, and any T or N, and the stage will be 4A. Thanks for your attention.